MC didn't get the memo, the blue memo. We were saying before you came that all of us have blue outfits and blue.
Greetings and of course a very special hello to everyone looking at us right now via the stream. I am Jason Williams, media personality and soca personality here in Trinidad and Tobago, and it is indeed my honor to be part of this amazing conference, the 65th annual CARPHA Health Research Conference. Of course, our theme for 2021, the pandemic, NCDs and climate change. The Caribbean's triple threat. Of course, we're going to get into the official start of the conference later on, but of course, we will go into the special forum on vaccine hesitancy. That's the first order of business today. Of course, this year's conference, it's the 65th edition. We turn 65, but 2021 is a special one because it's the first year, the first time we are doing the conference in the virtual space. We are powered by VFairs and supported by our platinum sponsor and partner, Agence Française de Développement. Of course, the stream is coming to you live from the Trinidad Hilton and Conference Center. And we have the technical support of AV IT Support Limited here in Trinidad and Tobago. We will have our feature lecturers today. Of course, the focus will be on the impacts of climate change on our health. Before we get into the special forum, let me acknowledge the presence of Dr. Joy St. John, Executive Director, CARPHA. Let me acknowledge the presence of our Chief Medical Officers, the members of the Executive and Senior Management of CARPHA, members of the Research Advisory Committee. Featured speakers are Professor Hugh Montgomery and Dr. D. Campbell Landrum, conference delegates, ladies and gentlemen. As mentioned, vaccine hesitancy, of course, this is a global discussion, and it's one that we in the region are also going through that particular pace. And on a personal level, I've had discussions with many contemporaries and colleagues about, of course, that same topic. And to really get things going, I want to welcome Dr. St. John, who will do the official intros for our moderators and panelists as we get into the special forum right now on vaccine hesitancy. Dr. St. John, it's all yours.
Thank you so much. And I am actually thrilled because I am welcoming Chelsea Clinton, who is such a fabulous person in this forum of the relaxed discussion. And we're going to have a relaxed but informative discussion. And my role is to stop talking quickly. But before I stop talking quickly, I am going to give you a little bio on the three members of our panel. So first, let's start with Chelsea Clinton. As Vice Chair of the Clinton Foundation, Chelsea Clinton works alongside the Foundation's leadership and partners to improve lives and inspire emerging leaders across the United States and around the world. This includes the Foundation's Early Child Initiative, Too Small to Fail, which supports families with the resources they need to promote early brain and language development, and the Clinton Global Initiative, CGIU University, a global program that empowers student leaders to turn their ideas into action. A longtime public health advocate, Chelsea holds a Bachelor of Arts from Stanford, a Master of Public Health from Columbia's Mailman School of Public Health, and both a Master of Philosophy and a Doctorate in International Relations from Oxford University. She lives with her husband, Mark, their children, and a dog in New York City. Welcome, Chelsea. I'm really excited to see the magic that you will bring to our little forum. Next, I welcome Dr. Rashad Massoud, who has served as Senior Vice President and Chief Program Officer at AmeriCares since September 2020. In this role, he oversees the organization's health programs for people affected by poverty or disaster, its emergency response team, and its global distribution of more than 900 million in medicine and supplies to more than 90 countries annually. He also leads AmeriCare's global response to the COVID-19 pandemic, including the distribution of PPE, delivery of essential primary healthcare services, and training and mental health support for frontline health workers. Welcome, Dr. Massoud. And last but by no means least, I welcome Dr. Karen Broom, who has served as an immunization advisor for the Caribbean region at PAHO since April 2020. Previously, she worked in the Barbados Ministry of Health for over 20 years, including serving as the country's national immunization manager from 2014 to 2020. Dr. Broom holds a master's in public health from the University of the West Indies and brings a lot of practical experience to today's discussion. So thank you very much for joining us. And over to you, Chelsea, so that we can enjoy this panel.
Well, Dr. St. John, thank you so much for welcoming us so warmly, kind of in this virtual space, but kind of very much grateful to be in kind of actual community with you here today and with all of the participants. And I just want to say how honored we have been at the Clinton Foundation to have worked with you, Dr. St. John, in so many different capacities over time, including now kind of on the important urgent issues of building vaccine confidence throughout the Caribbean, really throughout our hemisphere and across the world. And Dr. Broom, I hope that we could start with you, given your role at PAHO, kind of focused on immunizations over the last now year plus, but also kind of with all of your previous experience, where I think in kind of every role you've had to really work on kind of answering questions and combating hesitancy around vaccines and really building trust in vaccinations. Could you kind of just give us a snapshot of kind of where we are at the moment in the Caribbean in terms of COVID-19 vaccinations, and kind of also where we are in terms of vaccine hesitancy?
Thank you so much, Chelsea. And let me say, it's a pleasure to be here. And I thank CARPHA for allowing PAHO to have a voice in this very, I think it will be very useful and very interesting discussion. The Caribbean, from the time that we understood that COVID-19 vaccine would be a possibility, we started to plan. It was amazing how the healthcare providers, the logistics persons, from persons use some of their volunteers and civil society, and the whole immunization program started to plan. With the assistance of PAHO, we were involved in all of the planning so that when the vaccine came, the deployment and the administration would work like clockwork. Because a lot of people just don't understand, it's not about just getting that vaccine from the vial into the arm. It's getting that vaccine into the country, and then how do we store it? How do we deliver it? Who administers it? In what conditions? How? And the Caribbean has really stepped up in terms of the strategy and the whole campaign for the COVID-19 vaccine. I'm sure we are aware that we have a long, rich history in vaccination in the Caribbean, and we actually have been world leaders in terms of childhood vaccination. So we wanted to bring that same focus of the childhood vaccination and all that, our platforms and all that have made us successful, and also put that into the vaccination of adults in COVID-19 vaccination. The campaigns really started well with the administration and with the help of healthcare workers who some worked around the clock. And the populations really came out and were excited and wanted to be vaccinated. So we started really all guns blazing. And in each country, persons were excited and encouraged each other to just come out and be vaccinated. Of course, as the campaigns have gone on, those early adopters and those ones that are excited and the ones who have read a lot of vaccines, seen the positive benefits, have come on board and they've become vaccinated, they've gotten vaccinated. Of course, we started with our priority groups, which is the elderly and the healthcare workers and those who will be at risk. So very good administration. And we continue to encourage people to come out and be vaccinated. So right now, we have done all of those who have come to access, and we're going for those who we need to meet in their communities. So we're going into the communities now to ensure that every single person in the Caribbean has access to COVID-19 vaccine.
And Dr. Broom, could you also just share what kind of barriers of not access, because I think more than aptly pointed out, it's not just about kind of getting the shot in the arm, it's about ensuring the shot is there to be put in the arm. And we certainly have had lots of access challenges here in the United States as well. But like presuming like the shots are there to be kind of put in the arm, that it's not a metaphor, that it's actually something can happen. What are the kind of hesitancy barriers that you have seen kind of from your position at PAHO really across the Caribbean? And also I think importantly, what have you seen to help people who maybe initially were hesitant then make the decision to be vaccinated?
Right. We have seen that hesitancy waxes and wanes. So sometimes you have quite a number of people who are hesitant. And then as time goes by, those same people then become quite comfortable with taking the vaccine. And it's for different reasons. Some people just need time. Some people need time to assimilate the information, time to become comfortable with the benefits that are promoted. So over time, those people who might have initially been hesitant have come forward. Others have benefited from champions. So whether that has been their pastor in their church, whether that has been a community leader, whether that has been a sports person, a popular sports person that has come out and said, listen, I have been vaccinated. And we find that the influencers do a good job in bringing people, in educating persons, in talking about the benefits, but also talking about what people's concerns are. And some concerns are about side effects. And we've done a lot of education about side effects. We've launched in our communication campaigns, we've had specific posters and videos just speaking about side effects. And we have also done that with adverse reactions. So it is all about the communication, the communicators, and the information and how we target the information to the specific population.
So Dr. Broom, I think so much of what you just said may seem kind of so obvious and clear, that we need to have messages rooted in science that are accessible and understandable to people, delivered and consistently delivered by trusted messengers. And yet we know that choreographing all of that can actually be quite challenging, and doing it kind of in a consistent way, because unfortunately we know that kind of the kind of anti-vax community is always kind of communicating, unfortunately, that we have to also always be communicating kind of messages rooted in science, rooted in evidence, and rooted in facts. And I wonder now if we could turn to Dr. Massoud, who I know kind of with AmeriCares has been doing so much work here in the United States to help support vaccination efforts across the country, and really have recognized all along that to effectively support vaccination efforts, we have to have communication kind of not just as an afterthought, but very much kind of integrated into how we talk to people about vaccines and vaccinations, how we answer the questions along the lines of what Dr. Broom was kind of sharing in the Caribbean, questions about what is the vaccine, kind of what side effects might there be. And so I just wonder, Dr. Massoud, if you could now kind of join us and share what you've seen from your AmeriCares perspective to work really well here in the US, what maybe hasn't worked as well, to possibly just kind of provide further insight that could be actionable in the Caribbean or candidly anywhere. Well, oh, I think you're on mute, Dr. Massoud. Yep.
With pleasure, Chelsea. Thank you. In our work at AmeriCares, one of the things we observed is how patients are influenced, how people are influenced to receive or not receive their vaccine. And one of the big factors that we realized are the health workers themselves. So if somebody goes to their physician and their primary care physician who takes care of them for everything else recommends that they get vaccinated, the likelihood is they will be more open to being vaccinated. So that's something we've been seeing in our work at AmeriCares over and over. More recently, we were very fortunate that CDC has awarded us an opportunity to work on vaccine hesitancy amongst the health workers themselves. Now, the idea is that, yes, a good proportion of the health workers are actually vaccinated themselves. However, there is a proportion who are not, and in working with those who are not, we're more likely to be able to influence them in such a way that they also influence their patients. So we're trying to reach the community through the health workers. That would be one of the major ways in which we can get there. It goes back to opinion leaders. Every social system, every social sector in that system listens to certain individuals, and we do know that people for their healthcare do tend to go to their physicians. We do know that they tend to listen more to them, and so trying to affect that chain is at the heart of what we're trying to do here. We're doing this in the US throughout the country, but also we're also working in Puerto Rico and in the US Virgin Islands in that same activity.
Dr. Broom, I wonder, if we could then return to something that you said earlier, which is that, historically the Caribbean has been a real leader in childhood immunizations. I mean, in many years, the Caribbean does a better job than the United States does, actually, of vaccinating children against kind of all vaccine preventable, childhood illnesses. What do you think, because you alluded to this earlier, kind of what do you think kind of all of those historic successes helped prepare you then to be effective communicators for the COVID-19 vaccines? And also, how do you think it is different when we're talking about an adult and now an older kind of child population versus when we're just talking about kids? So kind of what has been similar and what has had to be different?
Thank you so much. I think that is a very insightful question because a lot of persons just believe it's just immunization, but your target group matters. If it's children, it's a different messaging to if it's adults. And traditionally, adults have not been a big category for vaccination in the Caribbean. We have learned what transitioned well was we have learned that the messages have to be targeted, that we have to listen, that we can't assume what is causing persons anxiety, because that's when you go off track and your messaging doesn't hit that spot. So a lot of social listening had to happen. We had to do surveys. We had to be listening to what people were messaging on WhatsApp. We had to do a lot of focus groups. So the listening to the community was extremely important. The difference was that with children, you get that one-on-one when that parent comes to you. You can start even before, when mommy's pregnant and you have parents there. You talk about immunization, you introduce it. COVID didn't give us that leeway. It was, COVID is here, we're in a pandemic, the vaccine will work, and there was the vaccine. So a lot of the preparatory work and a lot of the experience about, oh, we've been doing this for many years, it wasn't there with COVID-19. And the speed of the development of the vaccine caused people concern as well. So it was about targeted messaging, listening, social listening, so that we could understand the hesitancies, and then messaging and working towards getting out that information, and also making sure that we had